Um, all right. So today I'm going to step outside of perhaps the clinical realm a little bit and focus on consumer sleep technologies, which are essentially products that we can all purchase to self-monitor our sleep and really explore some of the data that's out there and what it's taught us about population sleep essentially. So some of you may have some of these devices, and I hope that you find this compelling and interesting as far as how you interact with these products. So here are my Conflicts Sleep Score labs. I'll talk a little bit more later, but the technology behind the Sleep Score app was invented at the University of Washington. I was a co-inventor on that with Rajalakshmi Nandakumar and Sham Golakota in computer science and engineering. And that technology was licensed subsequently to ResMed and then sub-licensed to Sleep Score Labs, which is now integrated into their app. So here is some of the.
Congratulations, by the way. I saw your patents, so that's fabulous work.
Yeah, thank you, Rich. Yeah, that was really exciting for me, and so here's just some of the products that I'll talk about. There's so many of these, I can't touch on all of them, and I'm not necessarily talking about validation because all of these products have an element or have been validated. They're not perfect, but they're reasonably accurate. So the Fitbit Charge HR, the Aura Ring, and the Whoop, they all use heart rate variability, and they use accelerometry, which is basically movement, to monitor sleep and wake. And then the Aura Ring also uses something called photoplethysmography, which is what's utilized for pulse oximetry. Heart rate variability is important to realize that as we fall asleep, our temperature actually has to drop and our breathing becomes more regular, our heart rate becomes more regular as we go into deeper stages of non-REM sleep. And then when we go into REM sleep, all these things become more irregular. And that's kind of how the heart rate is leveraged in order to determine sleep staging. We also look at the Sleep Score Max and the S Plus. The S Plus is the earliest generation of this, and the Sleep Score Max is the latest generation. These are standalone devices that sit at your bedside that emit radio frequency waves that reflect off you that are then picked up back at the device. And as such, it can determine whether you're moving in bed and then also your respiratory depth and rate. And then it uses that information through sophisticated algorithms and machine learning in order to detect various sleep stages. And then, as I mentioned earlier, the Sleep Score app, which if you go to the App Store, it's just called Sleep Score. And basically what it does is it turns the phone into an active sonar. So the phone sends out chirps at sound chirps at 18 to 20 kilohertz. You can't hear that. It reflects off you and then is picked up back at the phone. And much like the radio frequency, it determines respiratory depth and rate, and then uses these algorithms to determine aspects of sleep. One thing just up front that I like to throw out there is you may hear people talk about these devices as wearables. And that's true. Many of them are worn, but the radio frequency and sonar based devices are not worn. They don't touch you. They're contactless. And so the preferred term is a consumer sleep technology, which is more of an umbrella term that can cover all of these devices. So just keep that in mind as you have discussions about these things. So for the longest time, we measured sleep much the way that we might look for our lost car keys on this street. We could only do it for one night in a sleep laboratory in a highly controlled environment with people wearing so much equipment that there's no way that it was approximating a typical night's sleep. Now, these consumer sleep technologies allow us to monitor sleep longitudinally, days, weeks, months, even years in a person's typical home environment. So it's way more ecologically valid. And in many senses, it would be akin to putting a street light every 10 feet as we looked for our car keys. So it's really allowing us to illuminate sleep on both the individual and population levels in ways that we've never been able to do before. So it's transformative in the sense that it extends our reach to understand objective sleep. And if we think about the market here, it's exploding. So this is a Global Market Insights look at sleep tech devices market. So between 2020 and 2027, there's going to be a compound annual growth rate that's estimated at greater than 17.5%. So you can see it's going from a $12.5 billion industry just 2 years ago to a $40.6 billion industry in 2027. And this is made up of a lot of different aspects. You can see they do mention this wearables segment. Here, non-wearables segment would be things like beds and smart beds and things like that. So this is something that's really been taking off. And for the longest time, the sleep medicine community kind of ignored it. But then I think began to realize that this is going to transform the way that we take care of patients and the way that we understand sleep. And so the American Academy of Sleep Medicine 4 years ago generated this position statement on these technologies. And essentially, these statements are saying that clinicians should have a general awareness of these technologies and be able to discuss it with their patients, and have kind of a general framework of these devices and the evidence of their validation. Most of them are not FDA cleared, although some of them are attempting to move in that direction. But really, these are tools to open discussions with patients about their sleep and sleep health. And I think, once a person starts to monitor their sleep, they're really telling you that they're interested in their sleep and they're interested in improving their sleep. So they're in that kind of contemplative stage of improving things. All right, so let's just get into a number of studies that have been done to assess just different aspects of sleep. So this first study, which involved the Fitbit Charge HR, looked at over 500,000 nights from over 23,000 Fitbit users for a 1-month period back in 2017. So this is pre-COVID. Age was provided in, it was self-reported and provided in 5-year bins, and only major sleep periods were analyzed. Bed and wake times were automatically determined based on the movement data. And then, so let's look at some of the data here. So we have weekdays and weekends, all right? And it looked at these regions. So Australia, New Zealand, Singapore, Hong Kong, and South Korea. So Australia and New Zealand here in blue is considered to be Oceania. And then this is East Asia, Singapore, Hong Kong, and South Korea. And what you can appreciate is a couple of things. The public health recommendation for sleep is for adults to sleep 7 hours or more on a regular basis to support optimal health. You can see here that the East Asian groups are not getting that recommended amount of sleep. And, depending on the age, some of the oceanic communities are. You can see that the nadir in sleep is occurring around the ages of 46 to 50 or 46 to 55, essentially. And you could argue that this is maybe when work is most intense for folks. What I'd also like you to appreciate, as far as this difference between Oceania and East Asia, is that if you look at bedtimes and wake times, it's really more of a delay in bedtimes than an issue with wake times or earlier wake times causing this difference. And then lastly, you can see that the difference isn't as great on weekends, and also both groups were sleeping more on weekends compared to weekdays. And this is something that we look at in sleep medicine as kind of a clue or a giveaway that somebody's sleep deprived. If you're sleeping longer on weekends than you are during the week, that's an indicator that you're probably not getting enough sleep during the week. So really interesting, massive objective data on population scales that is not only interesting, but it would also suggest, for this problem in East Asia with sleep, that public health measures should focus on having these individuals try to get to bed earlier rather than focusing on the wake time, because again, this is where the problem exists. This is from that same study, and just looking at the difference between weekday and weekend sleep. And you can see that this is a bigger problem for the younger generations. And it becomes less of a problem as we get older and perhaps enter into retirement ages where we have more control over our sleep schedule. And it's also a bigger problem for women than for men. Can consumer sleep technologies differentiate those with insomnia from healthy sleepers? So this is an important question, because if we're going to begin to use these technologies from perhaps a screening perspective, or maybe in the future a diagnostic perspective, can they differentiate these populations? So this was a study using the Sleep Score Max radio frequency device in 44 individuals that met International Classification of Sleep Disorders Volume 3 criteria for chronic insomnia, and 29 healthy sleeper controls. Ages range was 19 to 54. And there were 21 females. So Sleep Score Max was used recording sleep periods for 8 weeks. And we looked at group differences in both means and within subject standard deviations, or essentially night-to-night variability in sleep. So in this work here, and this was work I did with a group at Washington State University, you can see that there are differences in some of these measured sleep parameters. So, I won't go over each one of these figures, but you can see here for wake after sleep onset, which is something that, we'll often see in people with insomnia, that indeed the insomniacs had more wake after sleep onset than healthy sleepers. Mean total wake time, this would include sleep latency, was also higher during the sleep period in insomniacs than healthy sleepers. And then sleep efficiency, which is the percentage of time that you're in bed, that you're trying to sleep, that you're actually asleep, was lower in insomniacs than in healthy sleepers. So this would be findings that we would essentially expect to see, or differences that we would expect to see. And the device was able to make that differentiation. And so you could surmise that moving forward, we may be able to use these devices to screen for insomnia. And then if we look at the night-to-night variability, the within subjects standard deviations, we see more variability in these same parameters, the wake after sleep onset, the total wake time, sleep efficiency, and then here also for standard deviation of sleep latency. So the sleep latency was more variable, which is basically the time from when you turn off the light and put your head on the pillow to when you finally fall asleep. More, essentially more variability there for those with insomnia. Oops, went forward there. And then also for deep sleep, there was more variability in deep sleep in the insomnia group than in the healthy sleepers. So yes, this device could differentiate these aspects of insomnia in people with insomnia compared to healthy sleepers. And this just essentially confirms or is consistent with other data that's already out there on this topic. So, it's been shown greater night-to-night variability in total sleep time, wake after sleep onset latency, and number of awakenings in sleep diaries of people that complain about their sleep compared to non-complaining sleepers. There's also greater variability in objective measures as measured by actigraphy, which is an accelerometer, a clinical grade accelerometer that you wear on your wrist, that was associated with poorer sleep quality. And compared to non-insomnia controls, older adults with chronic insomnia report worse sleep and greater actigraphy-defined night-to-night variability. So really confirming research that's already out there. Okay, can consumer sleep technologies objectively assess digital CBTI treatment efficacy? CBTI is cognitive behavioral therapy for insomnia. So essentially, this is a standard treatment for insomnia, where through usually 6 to 8 visits with either a board-certified sleep doctor or a trained psychologist, we essentially teach people strategies for how to manage their insomnia complaints. And we know that it works as well, if not better, than medications long-term to treat insomnia. So this used the S Plus radio frequency device. One of the things about CBTI is that there's not that many people that can provide it. So there's a great need for it, but there's an access problem. And so some people have developed digital CBTI platforms that people can interact with that don't require another person on the other end. And so if you have here in this instance, we had 7 individuals that used the shut-eye digital CBTI, and it was a non-counterbalance pre-post comparison of a 4-week baseline to an intervention period, or to the intervention period. And a total of over 450 nights were analyzed with this data. And the consumer technology did show that those that received the CBTI did fall asleep 6 minutes faster. They woke fewer times at night. On average, they had 13 fewer minutes awake at night. They had more deep sleep, and they spent less time in bed, which is also, going to be something that's going to improve sleep efficiency. And there's this subjective measure, which is the insomnia severity index, also improved in folks that received the digital cognitive behavioral therapy for insomnia. So the technology was able to help ascertain whether or not this treatment was effective. All right, let's continue to move forward here and get more into the consumer realm and answer a question that some of you may have, which is, do air purifiers improve sleep? So this study used the Sleep Score Max, the radio frequency device, looked at 36 adults, which were predominantly male with a mean age of 44. And they tracked their sleep for this 8-week field study. So it was a within subjects pre-post intervention design. So they had 4 weeks of nightly product use and then 4 weeks without using the product. And the product was an Allen Breathe Smart 45i air purifier that was on in the bedroom environment 24 hours a day. And the sleep was measured, again, as I mentioned, with the Sleep Score Max, and then multi-level regression and paired t-tests were used to test for statistical significance. And if we look here at these subjective measures, you can see all of these improved. So time to fall asleep improved, number of times woke up during the night was reduced, and then time awake after falling asleep was reduced, ability to sleep through the night, feeling well rested in the morning, and sleep quality all improved with the intervention with the device. And then the nights per week that the person felt satisfied with their sleep improved. And then there was also a small but significant improvement observed in objective sleep quality when using the air purifier. And if you drill down a little bit more, you can see that using the purifier resulted in a reduced number of awakenings, less wake after sleep onset, higher sleep efficiency, more sleep maintenance, and less percent wake after sleep onset. So, modest improvements, but nonetheless, objective improvements were shown. So to answer the initial question, yes, air purifiers do appear to improve sleep. How about sound machines? Some of you may use sound machines when you sleep at night. Do they improve sleep? So this, we monitored sleep with the S Plus device. This was, again, a within subjects pre-post intervention design, comparing 2-week baseline period to 2 weeks of nightly sound machine use, 30 participants, 63% male, 725 total nights were measured, and the sleep experience was also subjectively assessed with questionnaires, and people were allowed to use their preferred settings on the sound machine. And then multi-level regression and paired t-tests were used. And so one thing that was interesting to me anyway was this question about, why do you use a sound machine? Now, from my perspective, I always thought people would use it to drown out noises in their sleep environment, because we know it's not necessarily sound is disruptive to sleep, but it's abrupt changes in sound. And although that was a reason here to block out noises, it wasn't the primary reason. Most people used it to help them relax and unwind, or to keep their mind off of thoughts that distract them from sleep. So I found that to be interesting. And at baseline, 60% of participants reported having racing thoughts or worry when trying to fall asleep. but with the sound machine, only 30% expressed that concern. Now, if you look at self-report measures, you can see these all improved. So time to fall asleep was reduced by 30%. Ability to sleep through the night was improved substantially, as were sleep quality and feeling rested in the morning. However, the objective measures that I've discussed before, those did not show improvement. So sound machines right now, the jury is a little bit out, but it suggests that it does improve subjective sleep, but it hasn't been proven to improve objective sleep. And this is also consistent with other studies in the literature at this point.
Nate, what do you think the difference is? I mean, sound machines versus an air purifier. Boy, they just seem like good standardized ambient noise in the background. Why different result? I'm sure I was a little surprised by that.
That's interesting. Yeah, because the air purifier will make a sound machine noise as well. It may be the having a cleaner air in your sleep environment may reduce allergics or allergies or allergic responses in the nose. And we know that when a person can breathe effectively through their nose, they can sleep with their mouth shut. And there's an advantage, a mechanical advantage to closing your mouth, because that tends to pull the tongue base away from the airway a little bit and open the airway. So it's really more ideal to be a nose breather in your sleep. And so that would be my guess for why there was a difference there.
And Mike Williams he just asked, do the air purifiers also make background noise? Perhaps it's two effects, he said.
Yeah, and that's a great point. And they do. And some sound machines are just fans, not just fans, but people use them as fans. Other times people dial in specific sounds, as we all know, whether it's crashing waves or rain or things like that. So the sound machines themselves are a bit more versatile, but yeah, it could be a combination of those effects. So that's a great point by Dr. Williams. Weighted blankets, you all may have heard about these. Essentially, a weighted blanket is a blanket that's going to be about 10% of your body weight. And so the question is, do they improve sleep? So a study looked at healthy adults with objectively measured suboptimal sleep. So 14 women and 16 men with a mean age of 51. This is a 6-week field study with a pre-post design. The ResMed S Plus radio frequency device was used, and multi-level regression was used for analysis. And here you can see that subjectively, all these improvements were found in feeling relaxed while falling asleep, being more well-rested in the morning, feeling more relaxed in the morning, improved sleep quality, and then also less bedtime stress and faster sleep onset. So the pre-post surveys showed a 36% increase in sleeping through the night without waking with the weighted blanket use. And if you look at objective data over here compared to baseline, there was a 7% decrease in wake after sleep onset, a 2% increase in light sleep, which is likely moving from wakefulness to sleep, and then modest but significant increases in sleep efficiency and sleep maintenance. So this data suggests that weighted blankets do improve sleep. What about olfaction? So can smelling certain substances improve sleep? You may have seen there's some pillow sprays for sale and things like that. This was a study that was done with IFF, International Fragrance Company. There were healthy females that were reported mild sleep disturbances. There were 31 of these individuals. Average age was 32. And they used a fragrance with an active compound and a placebo pillow mist for 2 weeks each with a 1-week washout. Radio frequency devices were used to monitor sleep, and multi-level regression accounted for nested data, and paired sample t-tests were used to compare self-reported sleep. So if you look at the self-report outcomes, these were all improved. So sleep onset was quicker, number of awakenings reduced, and wake after sleep onset was reduced. However, the overall objective sleep measures were not improved. However, a sub-analysis was done looking at the individuals that had the least amount of sleep disturbance. And in those individuals, they did find differences, modest, but the differences were there, such as wake after sleep onset being reduced, sleep maintenance being improved a bit, and sleep efficiency being improved a bit. So this would suggest that it probably matters who, what population you're dealing with. Is this an insomnia population? Is this a population with disturbed sleep? Or are you trying to maximize sleep or optimize sleep in somebody who's already a good sleeper and doesn't have problems? So this would seem to suggest, at least from a fragrance standpoint, that you can have modest improvements in sleep in those without substantial sleep complaints, but not in those with problematic sleep. And we're going to pivot to some studies looking at how COVID has impacted our sleep. And I think that we all can probably state that our sleep habits have been altered somewhat over the past couple of years. This study here utilized the Aura ring, which uses heart rate variability, accelerometry, and photoplethysmography to monitor sleep. So this was 113,000 users over 20 countries from January through July of 2020 compared to the same time frame in 2019. And the sleep midpoint is essentially an objective estimate of somebody's chronotype. And chronotype is kind of, what are you? Are you a morning type? Are you an evening type? Are you neither type? Mid-sleep variability was looking at a rolling 7-day standard deviation of the mid-sleep time as a proxy for sleep time regularity. So age, gender, and BMI were covariates, and multi-level growth curve models based on the sequential model building approaches used to quantify the effect of lockdown stringency on sleep. So if we look at these forest plots here, what you can appreciate is that, these different colors are indicating different months, but the orange and the yellow are kind of the months where the lockdowns were initially kicked in and were most intense. And, you can see this data over multiple different countries. In North America, I have down here in the red box. But what you can see that there is a substantial advance or a move towards being a little bit later in mid-sleep. So that might suggest that we are all maybe advancing our chronotype a little bit to accommodate our work schedules, where if we could sleep on a more consistent schedule that we define, that we may actually go to bed a little later and wake up a little later. And then mid-sleep variability was also greatest here when during the most intense periods of the COVID lockdown. So in some sense, the COVID lockdown freed people up to maybe be more consistent with what their chronotype actually is. Did COVID-19 suppression measures impact objectively measured population sleep? So this was a study that looked at the Sleep Score mobile app. That's the sonar-based app. Data was gathered from January to April of 2020, looking at over 177,000 nights from over 7,800 users. There's 49% female, mean age 52.4, all residing in the USA. And the start of the COVID period was defined as March 16th. If we all go back and recall, it was kind of in mid-March where awareness of the disease really took off. And this is when Google Trends, if you assess that, the searches for COVID exploded. And so that was really kind of, and this period of time at 3/16/2020 also coincided with the implementation of a lot of regional lockdowns. So it's a good time to select for kind of the point where COVID really took over. So here we have sleep duration in minutes on the y-axis, and then we have these dates here moving forward through time on the x-axis. The red dashed line is the COVID-19 search interest percent. So here you can see it explode, and actually when it explodes, when the lockdowns kick in, you can see that sleep duration does go up. And if we look over here, we can see that at least in people using the device, people were sleeping 7 minutes more. Now, of course, we have to be careful about generalizing this to the population at large, because not everybody has access to this app. People that do might be a certain population of individuals from a socioeconomic perspective. And COVID could have lots of impacts on sleep. I mean, if you got the disease, if you were particularly worried about getting the disease, if your employment was affected by the disease itself, or you had to care for children that were no longer going to school, that could all have impacts that could be negative on sleep. However, if you were no longer commuting to work and you could have more control of your sleep schedule, that could ostensibly have positive impacts on your sleep. So at least from this perspective, in this population, it suggests that sleep was extended a little bit during the lockdown. And then what about the impact on weekday and weekend sleep patterns in the USA? So this looked at the same data set here so the same time period, same data set, and the same onset of COVID awareness and COVID lockdowns. And there's a lot going on here in this slide, but let me focus you in on a couple of specific areas. If we look at sleep pre-COVID, the population was sleeping 9.6 minutes longer on weekends compared to weekdays. During COVID, however, population was sleeping only 3.8 minutes longer on weekends compared to weekdays. And so the difference between weekday and weekend sleep duration is 2.5 times greater before the pandemic than during it. And as I mentioned earlier, a difference in sleep duration between weekdays and weekends is an indicator of sleep deprivation. And so this again suggests that during the lockdown, people were able to have more consistent sleep schedules between weekdays and weekends. From a sleep healthcare provider perspective, that's an indicator of healthier sleep. So again, suggesting, at least in this population, that COVID and how it impacted sleep was positive. And this made me think of this study here, which was the American Time Use Survey, which was an assessment of a large number of individuals. And you basically asked them how they spend every minute of their day over a 2-week period. And here in panel A is Monday through Friday, and B is on the weekend. And what we're seeing down here is sleep time in hours. And then on the y-axis, adjusted change in activity time. So the greatest correlation or relationship between how much a person sleeps and their various activities, not surprisingly, would be work hours. I think we would all identify with that. But the next strongest factor was travel. And travel is really, during the week, is going to be predominantly commuting time. So this just further solidifies this notion, or this thought that I have, that these findings in improved sleep, longer sleep during COVID, is probably people taking what used to be commute time and converting at least a portion of that time into additional sleep. So what about sleep schedule changes during COVID pandemic and the relation to circadian preferences, or again, chronotype, morning type, neither type, evening type? And so this study compared bedtimes and wake times during the 4-week before and after the March 19th, 2020 California shelter-in-place order. And we looked at 5 different circadian preferences. So most people are neither type, but then you have, the morning and evening types on the extremes. And so we looked at associations between circadian preference and changes in bedtime and wake time using Spearman's correlation coefficient. So this assessed nearly 1,500 subjects over almost 70,000 nights. So what you can see here, let's look at to the left first. This is bedtime. So we have median bedtime on the y-axis, and then we have circadian preference going from strong morning to strong evening here. So this, the light gray line are the bedtimes before the COVID, and then the black is during. So you can see there's a delay, a general delay in bedtimes regardless of your circadian preference, a little bit more robust here for the evening types. And then if we look over here to the right, we can see that median wake up time, according to circadian preference, was a little bit later during COVID lockdowns compared to before. And that, again, this is a bit more pronounced for those with evening type. So if we sum it all up here, this is the change in minutes according to circadian preference. You can see the change in minutes, or the delay in bedtime, gets greater as you go towards evening type. The delay in wake time also gets greater as you go more towards evening type, but the morning delay was greater than the evening delay for the evening type people, which is what we might expect would be that they really want to sleep longer in the mornings. You know, that's the time that they're often, their sleep is curtailed. And, you know, we know that people with strong evening preferences, this may be a marker of poor health, because we've seen lots of, you know, things like alcoholism and depression and unhealthy behaviors and things like that being associated with people who are more evening types. So, you know, this data shows that at least for the evening type people, being on lockdown allowed them to sleep more consistent with their circadian preference, which is going to be a healthier sleep for them long term. Here's an interesting study just looking at was sleep duration altered following COVID vaccination. And this looked at 19 internal medicine residents who were mean age of 28, 53% were female. They got the Pfizer BioNTech vaccine, and this utilized the Whoop Strap 3.0 device that uses heart rate variability, and a 5% change in sleep duration was considered significant. And you can see here that in blue is the first dose, in kind of the pink is the second dose, and that on days 2 through 5 following vaccination, there were increases in sleep duration following the first vaccination, and days 2 through 4, increases in sleep duration following the second vaccination. This is what we would expect, because the immune response related to getting the vaccine, the cytokines and so forth, are soporific. They make you sleepy. So that confirms that. It's also interesting to point out that if you are sleep satiated and have healthy sleep, you're going to have a more robust immune response to a vaccine than if you're sleep deprived. So research has shown that, which obviously have implications for people getting the COVID vaccine and how robust their immune response is going to be. All right, I'm going to finish up with a couple of kind of whimsical studies here. One is just looking at sleep around the 2020 election. And so here, this used the Sleep Score app and assessed in nearly 6,000 subjects over 123,000 nights, what impact did the presidential debates, the vice presidential debate, and election night have on sleep. So compared sleep during those nights to the average weekday values in the period from September to November leading up to the election. This is a busy slide. Up here, we have bedtime, total sleep time, stress, and alcohol use according to these various events. And then it's summarized down below. But let me just say that the main findings are the night of the first presidential debate, in general, the population went to bed 9.5 minutes later and spent 11.7 minutes less time asleep. So pretty big impact there. Less of an impact on the other debates and less of an impact during the vice presidential debate. And then on election night, users went to bed nearly 15 minutes later. They spent over 24 minutes less time in bed and 19 minutes less time asleep. There was also a 13% increase in reported stress and 34% increase in alcohol drinking. So just kind of an interesting look at how current events or major events in the United States impacted population sleep. And then let's finish as far as the studies that we'll discuss are concerned with this one. Does good sleep produce more happiness? Of course, I would like to think that that is the case, but let's look at that. So this used the Sleep Score mobile application. Data set looked at over 1.2 million nights and 72,000 users from 26 countries. It was a pretty good split between male and female. The mean age was 51. And we only looked at countries where there were at least 1,000 subjects involved. And the happiness index was taken from what's called the World Happiness Report in 2020. And it's calculated based on surveys sent out to large populations to assess their well-being nationally on an 11-point Cantrell scale. And linear effect modeling was used for analysis. So before I show you the result, I'd be interested if anybody wants to hazard a guess as to which country is the happiest and sleeps the most. And if anybody wants to throw anything in the chat to make a guess about that, I'll pause. Okay, Mike throwing out Finland. Anyone else? Is that Bhutan or France or Bhutan? Excuse me. Okay, good. Yeah, France, Switzerland. Okay, good. Those are all good guesses. So let's go forward here. Mike, I don't know. You must have seen this data. Way to go. So it was Finland. So you can see that here, that there was a significant positive relationship between a country's happiness index and their total sleep time. So we have total sleep time here on the y-axis, happiness score on the x-axis. There was an R of 0.69 that was highly significant. So for every 1 point increase in the happiness score was associated with an extra 8.16 minutes of sleep. And there was also a positive relationship between time in bed and happiness index with an R of 0.68, and every 1 point increase in happiness score was shown to be associated with an extra 9.48 minutes time in bed. And let's just kind of take a moment to look at this. So India, way down here, not doing great as far as how much sleep the population's getting, and then also low on the happiness score. If we look over here, we have Singapore and Japan, who have higher happiness scores than we would potentially expect according to how long they're sleeping. The US up here, which is perhaps a little bit happier than you would expect based on how long they're sleeping. You have South Africa and Russia, which are perhaps a little bit less happy compared to how long they're sleeping. Then Canada is tracking right up here along the line pretty well. You have New Zealand with a really good score up here as well. So just really fascinating data, I think, as far as looking at sleep and happiness and perhaps, you know, cultural aspects of various countries and how they prioritize sleep and think about sleep and the impact that that has on the general happiness of the population. So just to begin to wrap up here, you know, what are the other opportunities for these consumer sleep technologies as they continue to develop? So I could envision them being used in the future to assess efficacy in pharmaceutical trials. We could begin to use them in sleep medicine to evaluate the efficacy of our treatments. So if somebody has sleep apnea and we're treating their sleep apnea, you know, how are they tracking on some of these devices? Are things getting better? It could be used to improve transportation safety with long haul truck drivers and it's making sure that they're getting adequate, good quality sleep. Continued sleep product validation and improvement. Lots of sleep products are produced every year. Lots of claims are made about them, but do they really improve sleep or not? I think we could begin to use these technologies, as I showed in some of the studies I just mentioned, to prove it. They could also be used just to better understand the natural history of sleep disorders. So just looking at what happens over time in those individuals. It could be used as ambulatory clinical threshold assessment. So if you're using one of these devices, your sleep quality is poor consistently. But some of them have advice engines to try to improve it. But let's say things aren't getting better, you know, maybe at some point it would recommend you go see a sleep doctor to get it taken care of. I know I have a teenager in my house. He goes to bed later than I do. How do I know if he's actually going to sleep when he says he's going to? These devices could be used to confirm that. And then leveraging the Hawthorne effect. So Hawthorne effect is when you know you're being monitored or measured, a lot of times your behavior will improve. And it may in fact be the Hawthorne effect that improves sleep in people that are using these devices. And it could be the Hawthorne effect in some of those studies that I showed earlier. But if sleep is improving from my perspective, that's really the most important thing. Is that's what I'm getting at. And if it's the Hawthorne effect, I'm okay with that. And talking about the Hawthorne effect got me thinking about this notion, which is somewhat of a popular concept in sleep medicine, which is orthosomnia, where some people say, well, listen, cool your jets on these consumer sleep technologies, because just by virtue of the fact that you're monitoring sleep, you're putting pressure on people to sleep better, which in turn could make sleep worse. And the thing about this is that I did a literature search on the orthosomnia, and there's only this brief small case reports of this. So I think this has not been shown and not been proven, and in many ways is overblown. But as I think about the Hawthorne effect and I think about this possibility of orthosomnia, it got me remembering a college philosophy class I took where I learned about this gentleman, Michel Foucault, who was a famous French philosopher who developed the concept of panopticism, or the panopticon, which originally conceptualized was a prison where the guards could observe all the inmates at all times, but the inmates did not know if they were being observed. And so they had to assume that they were always being observed. And I think that, certainly we live in this world today. I mean, there are cameras on every corner. We have phones. What we do on our phones is being tracked. So there is a lot of panopticism going on. And I think, as we imagine again the impact of sleep panopticism with these devices, ultimately people interact with these devices because they're interested in their sleep. They're interested in their sleep ostensibly because they want to improve their sleep. And if sleep improvement is the ultimate result from that, then I think it's nothing but a good thing. And so with that, I thank you very much for the invitation to speak. I thank you for your attention.